Familial clustering was first observed in patients with acute myeloid leukemia, which led to the identification of several germline variants in genes such as RUNX1, GATA2, ANCHOR-D26, DDX41, and ETV6, among others, all of which increase the future risk of developing myeloid leukemias. However, evidence for this hereditary or familial predisposition is also apparent in a subset of lymphoid and plasma cell cancers. For example, KDM1A LSD1 has been recently associated with familial multiple myeloma. On top of that, specific inherited bone marrow failure syndromes like GATA2 haploinsufficiency, short telomere disorders, Shwachman-Diamond syndrome, Diamond-Blackfan anemia, severe congenital neutropenia, and familial thrombocytopenias all have an increased predisposition towards developing blood cancers. I'm Abhishek Mangaonkar, Assistant Professor with the Division of Hematology and Department of Medicine at the Mayo Clinic, and I'm here to talk about our upcoming article authored by Dr. Mrinal Patnaik and me on hereditary or inherited predisposition towards hematopoietic neoplasms. The traditional teaching has always been that majority of blood cancers originate due to acquisition of somatic mutations throughout the lifetime of an individual, mainly as a function of aging, but also due to exogenous factors such as smoking, cytotoxic chemotherapy for solid cancers, among others. However, in the recent past, largely due to the observations of astute clinicians and the advent of genomic sequencing, we have come to realize that genetic alterations are passed on among families and contribute towards an increased tendency towards developing blood cancers. Not in all cases, but definitely in a sizable majority. Hematopoietic stem cell and bone marrow transplantation remains the only curative strategy for these patients, at least as of now. Hence, timely recognition of an inherited predisposition is critical to ensure safe choice of donors for our patients and to decide optimal intensity of cytotoxic chemotherapy before transplant. At the Mayo Clinic, we have an established dedicated clinic for such patients led by Dr. Patnaik and supported by the Center for Individualized Medicine. Patients undergo stepwise genetic testing, followed by appropriate disease-specific counseling on how to manage their underlying diseases. If an inherited predisposition is identified, we then counsel which family members should be tested and when, etc. All important questions for managing these patients. It is critically important for both the primary care physicians and oncologists, both in the academic and community setting, to recognize that blood cancers do run in families, and it is very important to obtain a thorough medical evaluation at the time of diagnosis, which includes a thorough family history. In our article, we have also outlined a list of key clinical signs and symptoms that clinicians could use as cues or hints that point them to think of an inherited predisposition, so as to enable them to provide appropriate referrals and testing for our patients. Thank you for your attention, and we hope you enjoy our article.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.